We'll move on to the homelessness presentation.
Mayor, Council, Ed is going to kick this off, and then we have a number of staff that are able to answer questions, but we did try to take a broader look at all the resources that are in this budget. Again, during the proposed budget presentation, talked about how much of a historic investment this was in helping to address our homeless community.
Good morning, Mayor Pro Tem, members of the Council. Ed Vanino, Deputy Chief Financial Officer. I'm joined up at the table with staff from Neighborhood Housing, Austin Public Health, the Downtown Community Court. And after I'm done kicking this off, I'll free up my seat for Christy Samilpa from the Homeless Strategy Office to come join the conversation, because homelessness is probably the singular service in the city that affects the most departments. As you go through this presentation today and you look at this historic investment of $62.7 million, it's not all in one department. It is spread throughout the city. The three folks that are up here, their departments do represent a large portion of the funding that we have for homelessness services, but there are aspects that reach throughout different organizations, including enterprise operations. As you can see up on the slide, this is a program area that supports both economic opportunity and affordability, as well as health and the environment, which, as you all know, are two of your top strategic priorities. What I wanted to do on this first slide is just take a different look at that $62.7 million. And what we're doing here is showing you that some of the funding is ongoing. It's money that we anticipate having in future budgets as well as this budget, but some of it is one time. As we've talked about earlier, a significant portion of our budget strategy this year was to allocate a large portion of one-time money towards homelessness services as part of our strategy for addressing future budget gaps that are anticipated under the 3.5% revenue cap. That's what you can see under the general fund. That $17.3 million of one-time funding is largely that source of funding that's coming from the general fund, budget stabilization reserve funds. That's the money that we're allocating an additional $7.7 million to the Housing Trust Fund, and you'll hear Rosie talk about what that money is going to be for when she speaks. But there's also dollars in there going to arch repairs and other homelessness programs. Other city funds includes enterprise operations, whether that be Public Works or the Watershed Department, who might be doing homeless encampment cleanups. The one-time piece has to do with general obligation bonds and some funding for a program that the Code Department is going to be implementing this year. And then finally, grants is another source of funding for homelessness services, and this money is largely federal grants, CDBG, and home block grants. So again, in total, $62.7 million divided amongst different departments, different funding sources, some of it ongoing and some of it one time, but kind of wanted to just create that high-level frame, and then we're going to let the departments walk you through the different areas of their budgets that pertain to providing services to the homeless.
Good morning, Mayor and Council. Rosie Truelove, Director of Neighborhood Housing and Community Development. On slide 3 of the presentation, you see the contracts and services that we're offering that help with tackling the problem of homelessness in Austin. First is a tenant-based rental assistance contract. This is new funding. We reallocated and reprogrammed through our consolidated planning process that Council has already approved to create an additional tenant-based rental assistance program. We're continuing our tenant-based rental assistance program that we've had for a number of years through the Salvation Army. The first one is really targeted primarily to COC, to folks that are on the COC. And the second program is really
What's the COC?
Continuum of care. Sorry. And then the second one is for folks that is more geared toward women and children and families. We have allocated about $1.8 million of our federal funds from CDBG for the first year for public facilities. We have continuing low barrier permanent supportive housing assistance with ECHO in our efforts towards Pay for Success. The rent availability program is another kind of a rental payment program that we have through ECHO. And then we have a contract with ECHO to provide permanent supportive housing and continuum of care consulting services to the housing department. We also have our rental housing development assistance program, which is generally funded through the general obligation bonds. We don't have an estimate of what portion of our rental housing development assistance program will go towards folks experiencing homelessness, but we do know that that's a priority, and we're continuing to push for increasing numbers of permanent supportive housing units through that program. But what we do have is $5 million that's coming through the Budget Stabilization Reserve Fund that's going to go into the Housing Trust Fund, but that will specifically fund the buy down of rental housing to levels that will support permanent supportive housing. And then we also have almost $11.6 million of what we consider to be more along the lines of homelessness prevention services, and that come in the form of our renter and homeowner assistance programs. And that's seeing an increase of about $4 million this year, and again, funded through CDBG and home and general obligation bonds and housing trust fund and the Budget Stabilization Reserve Fund.
Mayor,
Yes.
what are public facilities? What is it?
So we have, in anticipation of the acquisition of the property in South Austin for a homeless shelter or a housing-based, housing-focused homeless shelter, we allocated a portion of our CDBG funds to help promote and help with that effort. So those funds can be used for, if we were to acquire other property, it could be used for that, or it could be used to help with the rehab of that facility.
And then the renter and homeowner assistance. How much of that is homeowner assistance?
Let's see.
And the only reason I ask that, I don't know if that should be allocated under homelessness.
Some of that is our home repair programs is largely what you're going to see in the homeowner assistance bucket, and that is, we do consider that to be a prevention service because it does help keep people from being displaced and keep them in their homes. So that's why you see that lined up in there.
Okay. All right.
What is the difference between the various rental assistance programs? It looks like there's like 4 or 5 on here.
There are. Let me go back. They're different, largely based on the funding source and how we're structuring them. The first one that we had was the TBRA. The general TBRA that's administered through the Housing Authority for the City of Austin and the Salvation Army. That has our production estimate for that is 68 referrals, and that allows them to help house 68 families or women. We were looking through the consolidated planning process to help better utilize our federal funds to help with the homelessness effort, and in doing that, we were able to reallocate some of our home funds to create another contract or a similar kind of tenant-based rental assistance program. But this one is focused more specifically on folks on the continuum of care list. So we wanted to get the very hardest to house and provide assistance to them. The other two are different varieties of a similar kind of concept. The rent availability program is with ECHO, and that's where they're helping to locate, again, and navigate and house people, but we provide a piece of the rent subsidy for those folks. And then the low barrier permanent supportive housing is funded through the downtown density bonus. I just realized that I forgot to make that correction last night where it says home federal. But it's funded through our downtown density bonus dollars through the Housing Trust Fund, and it is specifically designed and in anticipation of covering part of the rental portion that's required for the Pay for Success program.
Which one is that? I'm sorry.
That's the low barrier permanent supportive housing, the ECHO contract. It's being raised to $950,000 for the coming fiscal year.
Mayor, did you finish your questions? I'm sorry, I didn't mean
I
to
just wanted to
insert.
confirm that for all these, it's basically paying a rental subsidy.
Yep.
So you have different providers that you're funding to do it for different programs, but it's all rental subsidies.
Correct.
Okay, thank you.
Just
Leslie and then Ann.
I just wanted to point out the permanent supportive housing continuing Continuum of Care Consulting, the ECHO contract, the last one, the $160,000 that's on that list. I really appreciate you continuing those monies. That was on the list of the priorities that I was hoping that the city manager would include in the budget, so it's great. And when we get to workforce discussion, when we're not looking at our housing staff, it'd be great for to get staff to talk a little bit about the workforce first, the win-win that we have. The prospects of people experiencing homelessness would have regular employment, job training for permanent employment, access to support services, and the assistance with housing, of course. So this is really important, and these folks can provide really needed help with encampment cleanups. So we're kind of in our parks and open spaces, and also assistance in our animal shelters. So this provides a really broad brush. That's $160,000. It's really going to some really good use. If you all could expand on that when we get to those portions. Ms. Hayden, thanks.
Ann?
Okay, so the portion of these funds that go towards dollars to provide housing for people right off the streets, like the rapid rehousing, is that through the ECHO contract, or is that through these?
Some of that is through the ECHO contract. That's the low area permanent supportive housing contract would facilitate that, as would the first TBRA, tenant-based rental assistance contract. Those are really intended to be
The two of those?
yes.
But the TBRA, who does that money go through?
It will be going through HACA as well.
Okay, so that's for dollars for people to live in HACA facilities.
No, this
Oh,
is
no. Okay.
this is rental subsidies to go
Anywhere, right?
Yes.
But is it for homeless people or low-income people?
The first one is for homeless.
Okay.
The second one is for, generally speaking, homeless, but it's really geared more towards women and children and families.
Okay, but the two that I'm focused on is that top one, which it looks like we've added $570,000 to
Yeah,
this
that's
year.
really bulking it up and creating its own standalone program.
But the total, I'm sorry, I just want to understand this. The total is the column that says fiscal 2020 proposed.
Yes,
the,
ma'am.
the right column is just how much we added.
Correct.
Okay. So, and then the low barrier one that's $950,000, that's also for those purposes. So, if we wanted to look specifically towards targeting some of our dollars for people that are lower on the coordinated assessment, lower in need on the coordinated assessment as a policy or in an approach to helping homeless individuals get into housing quicker. These would be the two funds that we might provide budget direction around, I would assume.
I think there's potential there.
Okay.
I think that's going to be an interesting conversation that we're looking forward to having
Okay.
with the new homeless strategy officer and with the new executive director for ECHO. I understand he's on board now, but we haven't had a chance to really get everyone together, obviously, because the homeless strategy officer isn't here yet. But we would like to develop some understanding and ways that we can, when we're looking at rehousing, and especially in the properties that are being funded with our general obligation bonds and through rental housing development assistance, that we can kind of best match folks with an environment that would be best suited for them.
Yeah, it's important that right now I just 2 seconds on this, and then that's a much longer conversation that we can have elsewhere. But right now we're housing people based on the coordinated assessment from the most vulnerable down.
Correct.
Which is, there's good reason for that. But what's happening is that means that people that could be housed more quickly, that don't need as much services, end up on the waiting list for a very long time.
Correct.
So in moving towards housing people as quickly as possible, it's been my thought that we need at least some funds, not all of them, of course, but some funds that we can say this pot of money goes to folks that are at a different level on that coordinated assessment, so that we can get those folks into housing as quickly as possible. They don't need as much in terms of services. So that's I'm just highlighting that for my colleagues, that's something that I am planning on pursuing as part of budget direction. Understanding that it'll take a while for the determining how it's implemented, and we need our homeless strategy officer for that. But I think as a policy matter, there's been a lot of conversation already in the social service and service provider community about that, and I've talked to ECHO about it, and I think there's acceptance that that's an important thing to do. So I'm just letting my colleagues know that I'll be bringing forward some budget direction around that. And so this tells me where the pots of dollars are, and if we wanted to, we can think about whether we might want to the extent it's possible, whether we might want to have an additional pot of dollars specifically for that purpose that's on top of this or not. So, thank you.
Allison?
Thank you. So can you help me understand what's being spent out of the Housing Trust Fund?
For our homeless services, we've got the low barrier permanent supportive housing that I neglected to fix on the slide at the last minute last night, which is that's really coming, and it's funded. That's the $950,000 this year that is funded through the Housing Trust Fund from the Downtown Density Bonus Program. Okay. The rent availability program is $156,000 funded through the Housing Trust Fund, and the permanent supportive housing or the continuum of care contract is funded through the Housing Trust Fund. We are also utilizing the Housing Trust Fund to hold the Budget Stabilization Reserve funds, which is $5 million plus another 2.7 that are coming to the Housing Trust Fund. The $5 million is going to be spent on through our rental housing development assistance program to buy down to lower levels of affordability. So, for example, if someone comes to us and they say they want to build a 50-unit single room occupancy development that will house 50 folks at 50% median family income, and they want $5 million. We might say, that's great. Let's give you an extra $1 million of this funding, not general obligation bonds, but this funding, and let's buy down to a much deeper level of affordability. So it's an extra source of funds to get us down to the very deepest levels of affordability that we need. The other 2.7 that's going to be coming from to the Housing Trust Fund is intended to be focusing around displacement mitigation, and we would like to see that maybe in the vein of a home repair program that would really look at these neighborhoods that are experiencing intense gentrification pressures and to help rebuild those homes there so that folks are under a little bit less pressure to sell, since they, and perhaps help them maintain their homes. I can go through quickly the rest of the prevention services to flag what is funded out of the Housing Trust Fund, or I can respond to that offline.
If everyone else is not interested, I would very much like to see what that's being spent on and the timetable that it would be spent over. We have over $14 million that's going in there, which is a lot of money to go into a fund that has had trouble spending its money when we have other needs related to homelessness that are not being addressed in this budget. And
I'm
so
happy
I
to
really
follow
want
up.
to. I would really like to see that. I'm pleased that we are fully funding it. There's a lot of extra money though in there, and I'm not fully understanding how that's being spent and how that's being spent in a reasonable time to make the investments that we need to be making to address the crisis that we have. So I would appreciate that extra
absolutely.
information.
Thank you. Tasha?
So my question is about, I'm looking at page 25, the public facilities. The way I understood your response to Mayor Pro Tem was that this included funding for the new emergency shelter?
This is a source of funds for the emergency shelter that can be used for renovation. These are not funds that we have available for us right now. They're next year's funds.
Okay.
And so we won't have access to them until after we receive our federal allocation. And so that will be probably more like October, November before we receive the funds from the federal government. Of 2019. So we couldn't use them for acquisition, but we can use, because of the time frame.
Yeah.
But we can use them to rehab the facility.
So I guess the question ultimately then is, what is the difference between the public facilities budget allotment and the emergency shelter contracts, general fund, and federal allotment? It's like it's duplicative.
What, that's
It's on page 27.
It's on your stuff.
I guess I'm
Okay,
trying to figure out why.
So would it be easier for me to answer the question, or would it be easier for me to go through the material and answer the question within the
I think maybe
material?
knowing that that's a question that I have as you go through your presentation.
Okay.
Thank you.
Okay.
Okay, so you'll get it in your presentation. Just before you start,
Yes, sir.
when we had the DAA meeting, we had someone who came to the microphone and basically said, I could get into housing really fast. If you could get me into housing really fast, I could get out. That's precipitated a conversation, 40 of them after that and 40 of them before that on that issue, and I think that's a really important conversation to have. I will tell you that I am really anxious to hear the advice of the strategy officer, just because I want her to really own whatever it is that is the plan that we implement this year, just from a management standpoint. I just think it's really important that to the degree that is consistent with the direction of the council, that she owns that and she thinks that what's happening is right, and so she does that. So I think it's a really important question to have. I think ultimately the council has to give that direction. From a timing standpoint, I don't know that if it fits with this budget process, and I think that putting, again, the block money for, I know that you even have identified places and sources for money and where it's going to be spent on here, but I would really like that strategy officer to be able to look at all of the money and then come to us with a recommendation on how it should be platooned, so that she owns that. So I will be leaning toward just a block allocation on it, and then having that officer come back to us with how the money was spent. That's how I lean.
So, Mayor, I'd like to comment on that. I certainly understand that perspective, and I'll think about that in terms of how to word the budget direction that allows some flexibility. But I also do not want to wait for our homeless strategy officer. There's a lot that our homeless strategy officer needs to do, not the least of which is putting together a detailed implementation plan. So I think it's possible to provide some budget direction that does not lock us in if the HSO thinks it's a bad idea. But this is something I've been working on for quite some time. I've researched it. I've talked to ECHO. I've talked to service providers. I don't think it's an idea that's an idea that has not been vetted. And so I understand the perspective, and I'll bear that in mind in terms of what I propose for people to consider. But I just want my colleagues to know that given the urgency of the situation, I don't think we need to wait. So.
I think if there's a way to do it that doesn't lock, because several of us have worked on this for a really long time and focused on these issues too. I think there are a lot of us
I'm talking about this specific issue.
This specific issue as well. So if we're doing it in a way that doesn't lock people in, then I'd love to work with you on that issue.
Mayor and Council, Rodney Gonzalez, Assistant City Manager for Economic Opportunity and Affordability. I did want to say that we've reached out to Lori as well with regard to the budget. We actually did have a discussion scheduled with her for this Friday to go over the budget. Unfortunately, of course, she is dealing with the hurricane situation in Florida, and so we're going to have to move that to later on, probably next week or so. What I did want to offer, though, is that if you don't mind, Councilmember Kitchen, allow us also to be part of those conversations. We've not heard this concern from ECHO before with regard to diverting money from prevention to housing. We completely understand that aspect of it. The concern, of course, that we would want to ask is it is less expensive from a prevention standpoint to invest dollars in that regard.
I didn't say divert. I'm not talking about diverting at all.
Okay.
So I'm sorry, did you finish your thought?
That was it. Just, allow us also to have some of those conversations with ECHO. As I mentioned, we haven't heard them from ECHO before, or the question that's come up, and we'd love to have those conversations as well.
Okay, let me just clarify so there's not misunderstanding. I'm not talking about diverting any funds at all.
Okay.
I'm simply recognizing an issue that's been identified by service providers for quite some time, including ECHO, and that issue is that we have, because of the way we do the coordinated assessment, coordinated assessment meaning the citywide coordinated assessment across service providers of what people's needs are, which is important. Mm-hmm. And there's a reason for the way the priority has been set in terms of our funding. The result of the way we apply that priority means that those with the greatest needs, and that means they need the most in terms of services, supportive services, are the ones that receive the funding first. And we never get down, because we don't have funding for everybody, we never get down to the person, like the mayor referred to, and there are others, of course, the person who doesn't have addiction needs, who doesn't have mental health issues, who doesn't have other needs, and they simply need 6 months of rent or whatever to get back on their feet. Those folks end up on the street for a long time, which increases the trauma, increases their the likelihood that they will develop additional issues and all those kinds of things. All I'm saying is that we need that in the interest of moving quickly in terms of helping more unsheltered folks get off the street, that if we can think in terms of putting some of our dollars towards that part of the population, and it would be best, of course, if it was increased dollars towards that part of the population, then I think we should do it. And it may be a short-term thing, and then we go back to the way we've done it before. But I think it's just absolutely critical that we find a way to think about that prioritization. That's all I meant.
Thank you.
That is, and of course that you all should be, and I'm surprised you all haven't had those, and maybe some of you all have had those. I certainly have had those conversations. I know that our social service folks have had those conversations.
Okay.
So,
Dahlia?
I guess kind of along the same lines as both of your comments, but I'm trying to understand of the 62.7, and I was going to ask this at the end, but unfortunately I'm going to have to leave in a little bit. Of the 62.7, it seems like just from the first part of the neighborhood housing, we're included in a lot of current funding, and that's really good to know, because I think as we continue to have this very important conversation in the community, to be able to tell the public we have invested millions over 15 years that has, maybe if this money hadn't been invested, instead of the numbers that we're seeing in homelessness now, they'd be bigger. We'd have bigger numbers in our homeless population had it not been for the investment that the city has made for decades. So it would just, if you could separate, this is the amount of ongoing funds, and this is new money that we are investing. And then I also had wanted to know, of the money allocated of the 62.7, is any of that, and I'm sorry, this was already answered in Councilmember Kitchen's question, is any of that unallocated for, as we look for new ways to address this issue, or is it all already allocated in some kind of contract that exists, or some kind of service that we already provide? And you don't have to answer that now. If that information could come, later, that'd be great.
I don't think that we've looked at it from an unallocated standpoint as much as from a flexibility standpoint. So that way, as the homeless strategy officer does get on board and works with you as council and community partners, we wanted to ensure that that we have some degree of flexibility in moving dollars around, whether it's towards prevention or whether it's towards housing. So I wouldn't necessarily characterize it as unallocated as much as we've worked in some flexibility in there.
Okay, so in that flexibility, because we're getting, I'm sure many of us are getting approached by nonprofits who have never depended on city funding, but they see that we're focusing on this, and they're coming and saying, hey, we help homeless people, and here's, one in particular was Dress for Success, who provides clothes for people to have interviews and get some jobs, and they do help a portion of the homeless community. And so it'd be nice to know where to direct them to. And obviously, they're coming to us during budget time, and so with that one in particular, is a very small ask. And so, I know we've been trying to not get into, the old practice of making a motion to, fund a specific, but we rightfully get asked those questions, and you hear about all these great programs, and you want to be able to help them and help guide them through this process to help get their program funded.
Absolutely. In one conversation, you all have heard me say this before, which is that the city of Austin can't be the only funder of all things homelessness. And I think this is where we're going to have to rely on other agencies to step up to the table, whether it's county agencies or district-wide agencies. Everyone has a role in funding the issues in front of us. I certainly appreciate that individual organizations are coming to council. They come to us as well. But you are going to hear us state very loudly that the city of Austin has revenue caps that we are dealing with, and that we are going to have to look to other funding sources to begin doing this as well.
Jimmy? I'm sorry.
I mean, we give that the same explanation, but that doesn't stop the ask. And so if we're going out there in the public and saying we are increasing our funding for this, I don't know where the increases are happening. And when people hear we're increasing the funding to this, they're like, well, if you're increasing it, you know, we've been helping, and we could increase our capacity to help by giving us more money. And so, believe me, you know, I tell people the city can only do so much. We have revenue caps and all that. But if there is in fact an increase in funding for this area, and organizations want to expand their, is that increase is the increase in funding? And I don't know what that is. I don't, because the way it's presented here is, we're spending this on this and this and this and this. What is the additional money we're spending, and where is that additional money going? I guess is my question.
We'll try to be more clear with that. And then I misheard you, because I think then what you're talking about then is the prioritization of the new money and where it's going to. Okay.
Jimmy?
Yeah, and you know, something that really struck me last night when we were doing the hearing, and we've heard this phrase for many years, the budget is a moral document. And I've been really wrestling with that, because we all want to do the things. You know, the budget is constrained, even if our morals are not. And I don't know that that same conversation is happening at other levels of government or with other entities. And I think sometimes they are and sometimes they're not. Something else that I learned this week in talking with the Salvation Army, went toward the Rathgaber Center, was that 20 to 30% of the folks in their shelter are coming from other jurisdictions. So we increase our funding of the Rathgaber Center as we take on folks experiencing homelessness who entered homelessness in Round Rock or San Marcos or in the ETJ out of other areas of Travis County. And I don't think that the funding is being balanced appropriately between the jurisdictions who are having those issues. And people are entering homelessness for different reasons in those communities. It's not necessarily always the same reason. There's domestic violence issues that tend to put people into homelessness as well. These are issues that we can't solve before budget adoption, but they are issues that I am certainly committed to working on through my role at the CAPCOG Executive Committee and as the chair of the CAPCOG Economic Development Board. We won't be able to do so much of this is one-time funds. We won't be able to sustain this alone. And I'm perfectly comfortable with a moonshot approach at the city level right now. And I'm comfortable with the city being the kind of collaborative center point. We are the central city. We have to bring more of our partners to the table when folks say that, you know, people who are experiencing homelessness are coming here from other areas. What they're thinking is California or Dallas or Houston, but what it's really happening is they're coming from Round Rock. And that is a decidedly different challenge, but one I think our region is willing and able to solve.
Just a quick thought. I am being approached too, as I'm sure we all are, by folks that want to help, whose programs all look great. The hard thing for me is I don't know whether it's better to add to this program or another one. So I think the prioritization question is what's real key. And I hope that the strategy officer and our staff can come back to us and say, this is the priority that you should be spending this money, because someone has to make hard choices or hard recommendations, spending it one way versus another way. And I hope that there are better experts than me to be able to guide that through. I also look at the money that's available for neighborhood housing. I hope that sometime soon we initiate collecting the $30 million in excess capacity in the Waller Creek TIF, so that can also be programmed dollars this year with respect to this challenge as we have talked about it. And I think everybody's comments are right. The city can't do this alone, and I think there is a regional governmental response to this that would be appropriate and welcome and real important. We also have a lot of people in the private sector and philanthropy that are stepping up at this point, and I want to encourage that. as a result, in part because of the conversation that's been happening in the community over the last couple months. And I think there are a lot of people that are trying to bring a lot of resources to bear, and it's going to be necessary. Kathy?
Yeah, thank you. Sorry, I had a conflict and missed the beginning of this presentation. I just wanted to say I did ask for some clarification through the Q&A about the breakdown of the new funding versus the old funding and how it's being spent. So hopefully that'll provide some more clarity around that. And I do think it's important that I answered this question a couple times when we were talking about the local government corporation. I think it's important that the funds, I think that's going to be a great mechanism for us to help really raise some additional private dollars that then I hope can pass through our regular contracting process. So, I am hearing kind of similar queries. There are these individual programs we should consider funding and whatnot, but I think we should, I really would support sticking to kind of our regular, a regular process of asking our staff, in most cases, to evaluate that through their regular RFP process for individual allocations. I did want to ask about one of the things that's come up in a couple different conversations is whether the increase in budget, and I think it's important to clarify to people who are watching it that the increase in money for housing and services for homelessness has been allocated. I mean, you've allocated it in different general areas, but it is not a lump sum kind of waiting for allocation for the most part.
It has been allocated, yes.
So I just want to make sure that that's clear. But is there funding within one of those pools of money for things like bus passes, ID cards, that kind of what are small individual expenditures, but for the organizations providing that assistance to individuals who have lost their documents and the kind of identification documents that they need to get into housing or to jobs? Is there a pool of funding for that somewhere within this budget?
I did want to mention that I think we're on page 2 of a 6-page presentation. I think we will get to that response, and so
Gotcha.
It's certainly up to council.
Then I'll just hold that.
Okay. Right.
So let's go ahead. We'll let you go through the whole rest of the presentation before we ask any more questions.
Okay.
Good morning, Stephanie Hayden, Austin Public Health. So I'm going to just kind of do a high-level summary and just kind of work through and kind of try to pick up some of the questions that have been asked. So overall, there is a $32 million investment between grants and general fund in Austin Public Health. Of that, there is an increase of $11.4 million in fiscal year 20, proposed 20, which includes $1.8 million of ongoing funding, and it will cover areas such as emergency shelter, permanent supportive housing, homeless prevention, which picks up rapid rehousing. One of the questions asked earlier about the difference between the emergency shelter and the public facilities. The emergency shelter picks up all of the funding that is, whether it's general fund or federal dollars, that go to at least 11 shelters within the city. So it ranges from just kind of your general shelters like Front Steps, Salvation Army, to SAFE, which is domestic violence. And so we have a range of shelters that the city provides partial funding for that. And so that is the difference between the line item for emergency shelter and the public facility one that Rosie spoke about earlier, which those are federal funds, as she stated, and that would go toward renovation. So that's the difference between those buckets. The other kind of highlight is the collaboration between Family Elder Care as the fiscal agent, and the other one's foundation is the workforce pilot. As you all know, there was a resolution this past fiscal year in FY18, and as a result of that, there was a contract. We started as a pilot, a collaboration between Austin Public Health, PARD, Animal Services, and Watershed, and there are actually homeless people that are working in 3 different departments. They are working at PARD, Watershed, and Animal Services. That has been a successful project because they are providing job development, which helps them with their soft skills. So they're paid for their employment, but then it also connects them to other permanent employment. And they have, with some of the match dollars that they've been able to get from other community partners, they have been able to add some additional supportive services, which has included the additional case management as well as connecting folks to permanent supportive housing. In the FY20 proposed budget, it's about $205,000 that is dedicated to that project, and that covers the cost of one crew. And then the last question that talks about ID and et cetera, typically within a couple of buckets, we're moving to a place where we're really trying to make sure as many clients are case managed. So within the case management process, as folks are working with them, there is some financial assistance in the rapid rehousing bucket, as well as within the homeless prevention dollars, because that's where case management and financial assistance is as well. And so it pays for those types of incidentals that individuals need to be housed. And so I'm going to pause right there, and I'll turn it over to Pete.
Good morning, Mayor and Council. Peter Valdez, Community Court. In the proposed FY20 budget, we have a couple of increases associated with our intensive case management program, which provides direct case management, full wraparound, utilizing a wraparound client-centered housing-focused approach. Many of the individuals that we are serving have tri-occurring disorders such as mental health, substance use, and physical disabilities. But we also encounter a number of individuals with traumatic brain injuries and developmental disabilities as well. On top of that, many of the individuals that we're serving also have extensive criminal histories. With our involvement with HOST, we also encounter individuals that don't have the criminal histories but do have the other characteristics that I described. But historically, most of the individuals that we serve in case management have a form of criminal history. So for FY20, there's a proposed 2 FTE, which are the two additional clinical case managers, and that is going to help us address our ongoing wait list. Last year, our wait list increased to 120 individuals that were requesting case management. We are down at 56. So these 2 case managers will assist with that. The amount that is on the slide also covers the fuel and maintenance for the case management vehicles that are assigned to us, and some equipment, licenses, and software for those individuals as well. I should say that we prioritize host referrals because we have a full-time case manager on that team who serves as a liaison between host and community court and connects those referrals directly to our case management program. So host referrals do not wait to get connected with a case manager. We make sure that they're connected as soon as they're referred because they've been identified as high risk by the host team. The second increase is for our social service contracts. Currently, each case manager who manages a caseload of up to 16 individuals accesses $292,000 in social service supports from our budget for that caseload of 16 individuals annually. So the proposed amount is $474,000 and $474,990. And again, that's going to go directly to social service supports. We will issue a solicitation and try to recruit providers that can fill gaps in our social service continuum, our own social service continuum. What we're seeing right now that is needed based on our discussions with our clients, and also through our involvement with the Austin Homeless Advisory Committee, is a great need for storage, and of course more housing availability. So in the current fiscal year, we contracted for 20 permanent supportive housing units, so that we would have direct access to those units, because again, listening to our clientele and AHAC, we recognize that the coordinated assessment process is not housing people fast enough, so we wanted to create a solution to that and at least be able to have direct access for the individuals that we were housing. So going on to the next slide, we included our agreements that we manage. So the Homeless Outreach Street Team contract with Integral Care is included on that slide. That contract funds 4 employees from Integral Care, one of them being a peer support specialist. And again, they support all the, they're out in the community together with APD and EMS, again, looking for high-risk individuals that they can connect not only to us, but that they can serve in the field. And then lastly, the expanded mobile crisis outreach contract, which in 2019 was allocated to APD, but we managed that contract. And in FY20, it will be allocated to DACC. And that contract pays for 20 clinicians and 1 medical provider. And that's all I have. Any questions?
Let's see. I think we have more slide.
Oh.
Good afternoon, Mayor and Council. Christy Simmel with the Homeless Strategy Office, and I will be closing out this segment. What you see before you are the other, some other initiatives and work by our partner departments in response to the efforts addressing homelessness. I won't read out the whole slide, but I will highlight a few items listed. You have the encampment cleanup. And that's at $1 million. We also have the Homeless Outreach Street Team, which you've heard about before. I would like to highlight the Workforce First program with PAR that has been mentioned. And then we've also got other items such as tenant temporary relocation and the portable toilet cleaning items. So this total amount, various funding sources, is about $4 million, which is a 1.2 increase from the prior year. I think with that, I'm going to turn it over.
That concludes our presentation, Mayor and Council. Certainly we'll take more questions at this time.
Okay. Jimmy?
I had the chance to meet with the downtown Austin Community Court folks earlier this week. Remind me again, you guys, you do serve the ones in most risk, or the ones that kind of the far end of the spectrum, but you still have a waiting list, is that right?
That's correct. So like I said in the presentation, we do prioritize the referrals from hosts. So the wait list is mostly individuals that come in voluntarily asking for assistance. So because
the ones who haven't yet entered criminal justice or don't have a criminal history.
Some of them do.
I see.
Some of them do and some of them don't. Some of them have heard about the services that we provided to their friends, so they come in asking for assistance.
Oh.
And we can't always do that if we get an influx of referrals from hosts depending on what's going on in the community.
Yeah. So, Councilmember Kitchen, I really do agree that we need to be solving the problem kind of at all the slices and getting folks out. But there will be trade-offs. And so I just want to make sure that we're talking about those directly and honestly with ourselves and the public. Because we could put more money into this program and not put it in the, that's just a reality of the budget process.
I'm not sure what you're referring to, because I absolutely agree that we have to cover all, I wasn't suggesting taking it from anywhere else.
No, what I'm saying is that where you put it is not putting it somewhere else. Like, no matter how you talk about it, there's a finite amount of resources, and we're going to have to just make some choices on where we put them.
Yeah, I look at it
Yeah.
a little differently, but I understand what you're saying.
Yeah.
Okay, Paige.
I'm excited to see that the Workforce First program is expected to be pulled into this next fiscal year. Can you tell me how many people are helped with that $50,000? Was that just a pilot that kind of started smaller and we can expand on it, or how is that working financially?
Councilmember, I do believe that was a pilot. I don't have the data available on the number of people, but that's something we can certainly follow up with.
Okay, yeah, I may either submit a formal Q&A or follow up with you offline to kind of understand that program, because I think it's really beneficial as we talk about making sure people have workforce training and a way to get back on their feet. I think it's a really pivotal part of this formula we're trying to work out with the situations we're dealing with right now.
Absolutely.
Thanks.
Thank you.
Just as a postscript on that real fast, I think it's a really good program, and some of the conversations that are happening in the community now with respect to cleanup issues, not necessarily in parks, but in the overpasses and some of the places that we've heard that challenge is happening. There's been some discussion about hiring folks that are experiencing homelessness that are in those areas to help police, to have people work to fill purple bags or to help police areas, and I think that might be a good way to support people right at the point, and at the same time helping with Austin, keeping Austin clean. I note, and it's something I'd like staff just to take a look at, I note that the Clean Austin fee was shown on the preliminary deal at going down by 65 cents. One thing that might be worth looking at is taking that down 55 cents instead of 65 cents. That would turn up $450,000. That might be able to help fund a program that was focused at this particular challenge in a way that I know it can't be a program for people experiencing homelessness if it's the Clean Austin fee, but it certainly would have that ancillary benefit if that was something that was worth taking a look at. Leslie.
That's great, and that segues right into the funding request for 3 additional Workforce First crews, which was a priority that I had submitted to the staff. The idea here was that 3 additional Workforce First crews would help address areas where the city has great need, like encampment abatement and mowing green space, vegetation management, repainting public restrooms, monitoring graffiti breakouts, working with park rangers and other environmental mitigation jobs. This definitely touches on the different things that you all have said earlier today about hiring the people who happen not to have a home at this point and help them work their way out of homelessness. So, Ms. Milpa, could you talk a little bit more about that program, or whomever has those details?
I believe we have a PARD representative. So
I see Ms. McKnight back there.
Well, can you tell me what else you'd like
I
to
think we're
know?
looking
Because
for
the contract is with Austin Public Health.
Right. So we're looking for, and I think it may be in there, but it's just separated out in different line items, an investment in fiscal 20 of $960,000 for resources for program crews, the additional crews, salaries, supervisory staff, social workers, job training, housing readiness, and equipment. I think that is in here from what the notes that my staff have given me from their conversations with staff, but it may be deployed in different line items.
So, your staff did send me a copy of that document. I'm familiar with that document. That additional ask for those additional crews is not included in this current budget. The only for FY20 is we have $205K that is included in this fiscal year budget, and so that only pays for 1 crew.
Okay.
The documentation that staff have put together will add, I think, 2 or 3 additional crews.
Yeah.
and it takes it up to the 950K.
So this is an item that we may want to put a little bit of focus on, since it sounds like a lot of folks around the dais are interested in making this happen, and it touches on a lot of different categories that we're really focused on. And then I just want to underline the concern that I'm hearing in the community all around the city about camping in the parks, and the fact that we're having to send our staff in there to clean up the encampments. And so I really want to prioritize some funds, and that's part of this $900,000 to address these circumstances. And again, some of that money would go to hiring the people who may be living in those encampments, so we can help catapult them out of homelessness and into some housing-focused shelter and move them down that continuum.
Continuing on, Allison.
Thank you. I wanted to ask some specific questions. Some of it I think is on page 32. So there were, I think, 2 additional social workers added at the library. If I'm reading this chart, that money's coming out of the library's regular budget as opposed to being incremental beyond the 6,000. Is that what this is saying? So we've taken resources, I mean, it's now being redirected to homelessness, but it's resources that were in our public library budget that are now being redirected to the social work. Is that correct, or am I reading the 2 columns incorrectly?
So the social workers at Central Library, that $185,914 is not new money. We had put those positions in the FY19 budget. They're continuing forward. The $6,000 is additional training for those 2 individuals.
Okay, so we don't have, because the budget information read as if those were 2 new positions, and so was confused by that. Okay, so they're not new positions. And then on this chart, PART is only showing up specifically for the $50,000. How are we capturing the hundreds and hundreds of thousands that PART is spending on cleanup right now?
So we do have some staff here from PAR. My understanding of the cleanups is right now they've been taking money from other areas of their budget to fund the cleanups. In this budget, though, we do have, as part of that top line item, encampment cleanups, we do have a small amount of budget for parks, $75,000. Of that, $1,025,000 is a budget in parks for homeless encampment cleanups.
Okay. So I'm going to second what Leslie is raising as an opportunity to use the workforce program potentially with this encampment, but I want to really just make sure that my colleagues are aware that PART is having to divert hundreds of thousands of dollars, as I understand it. I'm trying to get the exact number, but it's on that order. I've heard that they will have to do even more given the size of the encampments that we're hearing about. And that is being diverted from the safety lighting, from all of the other kinds of maintenance issues that were raised last night. There are all sorts of knock-ons of this, and I really think that we need to address that need to make sure that our parks are safe and clean. Some of these parks are in high-risk areas, and when you leave that kind of debris around that we're observing, it is extremely dangerous with the risk of wildfire that we have right now with our days and days and days of 100-degree temperatures. And so one option is the one that Ms. Poole suggested, which also provides the workforce, and I love solutions that help us address multiple priorities. But I'm going to really be looking for ways for us to fund that. I like your suggestion, Mayor, for looking at that clean community fee. But this is something that is going to be on a different order of magnitude from what we have been doing, and I'm trying to get clarity on what those numbers are, and I'm also trying to get clarity on what's going on the ground. What I'm hearing is alarming me in our parks, but I don't yet have as much concrete data on that, and there may need to be substantial cleanups from what I'm hearing. But again, I just want to underscore, I don't have all of the facts at this point, but as we're budgeting, we do need to keep this in mind.
Natasha.
Yeah, so you said something that intrigued me. So I have a sister who was in a really terrible car accident and suffered a closed head injury. And so I've been the trustee for her for going on a decade and a half now. And just, anecdotally from my observation, she needs so much in the way of assistance and advocacy. And, I'm just curious about, you said that a substantial amount of the people that you guys serve are either developmentally delayed or have closed head injuries. And so I'm just wondering, what does the long-term advocacy look like for those people? Just because there's so much, if you don't have ad litem or somebody with power of attorney or don't have a connection with family elder care for somebody to mind your dollars and, all the things that are, risk for that population of people. I'm really curious about what other agencies you guys work with and how do you help to ensure that they get the long-term, permanent, frankly, advocacy that they need.
So, unfortunately, we have the same housing challenge with those individuals than all the others. Because those individuals need such a high level of support, those group homes don't really exist. Highly functioning, good quality group homes don't exist for that population. So over the years, we see a lot of those individuals and individuals with the developmental disabilities eventually just die on the street because there isn't much that can be done. We do connect them to family elder care to manage their money, but still the challenge exists in terms of what type of housing they can access where they can get the full wraparound attention that they need.
So it sounds to me like that's certainly something we should be taking a look at in terms of our priorities. Again, it's anecdotal, but I've just made the observation throughout the course of the years. There have been complexes that are helpful, and like the one on Trinity, for example, they have a locked door, so there's a manager that has to permit you to enter the premises. But so many of these people are, unfortunately, subjected to being taken advantage of. And yeah, it's a major need in our community, and there definitely should be some order of priority placed on vulnerable populations in terms of our efforts around housing.
Yeah, the other downside to those individuals is that if they're in the coordinated assessment system, that system relies on self-report. So when you ask an individual questions, somebody that has developmental disabilities and brain injuries, they're not going to give the answers that are going to help them score high enough to be prioritized.
Thank you. Peel?
Yes, my question is also for the community court. Are you experiencing any veterans coming before your court?
So if they're veterans, they have to self-report initially. So there is no way for us to know if they're veterans unless they tell us. That being said, we don't have a high percentage of individuals that self-report being veterans.
And if they do self-report, how would y'all handle that?
We collaborate with the VA to see what types of services we can connect them with through the VA. But they will also receive all the other supports that we have in place, like anybody else would.
Oh, thank you.
Kathy? And then Ann.
Thanks very much. I have a couple questions, and one relates to an issue that several of my colleagues asked about, and that is the workforce first. Thank you. I couldn't remember the second part of the name. So this is a question that I've been asked, and I once knew the answer, and I've forgotten about how many individuals are served through that program. So if you would treat that as a formal Q&A, I know Councilmember Ellis raised it, but I think that is information that would be valuable both for others of us on the dais, but also for the public, because it does come up from time to time. And I guess I need help understanding or being reminded of the differences among the different programs. So I know that our watershed program is through drainage utility fees, managing cleanups in certain areas that are near waterways.
Yes.
But they are using an outside contract that does not include staff members who are part of Workforce First. Is that correct?
I'd have to find that information out.
So I think,
they are.
let me just lay out kind
Yeah.
of my body of question. I really like that idea, Mayor. I'm interested, though, in knowing how all of these pieces fit together, because we have the contract through Watershed to do encampment cleanups in areas that are along waterways, and we took care as a council to make sure there was language in there about making sure that those who are employed on that contract are sensitive to the needs of individuals experiencing homelessness and other things. And then TxDOT at one point had a contract, and Director Hayden, you were probably at the same ECHO meeting I was at, where they had a presentation about it, and I've now forgotten, but they had a contract through Easter Seals, I thought, to employ individuals, including individuals who were experiencing or had experienced homelessness, to do encampment cleanups under overpasses. I don't know how, with our taking on that responsibility now in certain places, that has changed, but that sounds like what you're describing, but it was a contract managed through TxDOT. So I don't know what of these are still going on and what the connections are among them, but I think I want to be sure that we know and understand that well before we start another new program. Perhaps the one way to do it would be to fund, to add funding to one of the existing programs and have it develop that way. I don't know. But I think, first of all, we just need to kind of get all those programs straight.
Manager. And I would agree with you, and I think that's the premise of the homeless strategy officer, is to coordinate all of the efforts that we're putting forward with regard to homelessness. I think this is an area, in particular the cleanups, that would serve well to identify who's doing what and through what means, whether it's contracts or whether it's with employees, and what are the funding sources. But I do think that that's one of those areas that we could be better coordinated at and more transparent in identifying exactly how they're done.
Yeah, I mean, the challenge for us here is that it's an immediate need, and we're going to be allocating funding, and so to some extent, I think, yes, there's a sort of a more global look that has to happen, but I think it would be helpful. That information right away would be somewhat helpful. So if it's useful, I'll try to develop some questions about it.
And Councilmember, we'll see how we can craft a memo with the information that we have so far, but as Assistant City Manager mentioned, we are just starting to wrap our hands around the different resources that are being dedicated to cleanups across the city, including with our partners, and then even the funding that could be used for some of those services, because some of them have more flexibility than others.
Sure.
But I appreciate your point about we're trying to make some budgetary decisions, and to the degree that we can provide any information before the budget adoption process takes place, we will get that to you. But to Assistant City Manager's point, this is a longer discussion, and we are just beginning to get more strategic and, I think, thoughtful about how we manage those resources more effectively.
Yeah, and in particular, I think the missing piece for me right now is the TxDOT contracts and kind of the status of those. And I can go back to my notes from that meeting, and Director Hayden, you probably remember it better than I do and may have all the information already. I was glad to hear, I hadn't realized Animal Services was part of Workforce First, and so that's Workforce First. That is great. Are the individuals who are working in Watershed working on cleanups? I think that was another question I had. Or are they doing more general work?
So within this contract, Watershed has 2 days a week. So PART has 2 days a week, Watershed has 2 days a week, and then 1 day Animal
I see.
Services.
The individuals rotate through those
They
departments.
rotate through those departments within the week.
Okay. Oh, that's interesting.
With that one crew, yes.
And then what kind of work are they doing within the Watershed piece?
April Thetford, Parks and Recreation. For Watershed, what they are doing is focusing on watershed open space lands to do abandoned encampment cleanup. So similar to what they're doing for Parks and Recreation, they're focusing on waterways and the culverts that convey the water through watershed properties.
I see. So they are doing actually the same kind of work that Watershed also has a contract with an outside agency to do near their waterways. These employees are working on it in I assume in non-waterways similar work.
Correct.
Oh, okay. Okay, thank you. I am wondering about, I assume, and again, I apologize that I missed probably the introduction that explained this. I'm assuming the 2 columns here are, this is what's proposed, and the increment is the increment over last year's funding, the increase, basically.
Yes.
Okay.
Yes.
Can you help me understand then the arch renovations? I had asked a question in last year's Q&A, and I think it yielded the information I'm going to pull up here in a sec, that there was, oh, I've gotten so much email I lost it. I had asked a question in last year's Q&A about the arch renovations and how much money generally there was in different pieces of last year's budget for arch, and I think at that point there was something like $310,000 there was $310,000 in the budget in the reserves fund or whatever for the courtyard improvements and garage improvements that hadn't happened. And I'm not aware of any work that has happened on that. And so I'm glad to see, I think there's been additional money added in this year's budget, but I'm not sure what happened. I'm not sure how we got from 310. The building services department had no work plan, but 310 available that can be used for capital renovations to the arch facility. It's been awaiting that renovation for a while. Here it suggests it's been reduced to 222,000 with an additional 122,000 added. So how did we get from 310 in last year's budget? No work has happened. It's gone down.
So
what's gone on there?
So the arch has, Front Steps has been able to do a few more internal type recommendations that they work with our office and building services with. So, for example, they've done some small things. So they've done something with the lockers, with the storage. They've also put in like ceiling fans. So there were some small
That's good. I didn't realize they had
improvements.
done those.
Now this additional $1.2 million, because there are some other, as you may recall, Austin Public Health asked Austin Code to go over to the shelter to kind of really do a kind of full facilities overscope. And basically as a result of that, there are some things that we found in that Austin Code found in that process. And so there are some facility things that we need to improve. And so these dollars will go towards some of those. So like plumbing, for example, there's a challenge with the plumbing.
I'm sorry, where is that in this
that
lineup?
is on the Austin Public Health
Oh, I
slide
see. In
for
the
the
different
arch
section.
improvements.
Okay.
Yes.
Perfect. And so the garage renovation is still there and can be used for external improvements.
Just a little clarity, we organized this presentation around departments, but there's multiple departments that are doing projects at the arch, really two. So on page 29, you'll see what Stephanie mentioned, $1,265,000 of new funding for a variety of arch improvements. And then I believe the line you were looking at was
on 32.
on page 32, which is a building services project for garage renovations and a different funding source than the money that's being allocated to the health department. So we could get you just one, we could maybe provide you information on just what is everything that's happening at the arch across different funding sources. It's just a matter of how you organize the information.
Thank you. I will try to remember to submit a question, but that would be great. If not, I think that'd be very helpful. The cleaning portable toilets, that is proposed at the same level. What are those for? Are those for the mobile ones, or are those?
That's for the mobile ones. It's the Public Works Department line item for cleaning those mobile, those three new facilities.
Well, that was the substance of my question. Are they for the mobile ones, or are they for our soon to be hitting the ground permanent ones?
Let's see if I have the.
And we can follow up on that. We'll follow up on that. And then security services at the arch. Can you please help me understand what that looked like? We spent a considerable amount of time last year meeting with staff and constituents and others about how we could implement what had happened during the summer pilot program from a couple of years ago, of having that outside security presence from APD officers, which went a long way to improving the safety for the guests at the arch and others in the area, of having that on-site presence. I'm not really clear on how security services, whether there was what this is telling me. It says it was it was a one-time pilot. Is that what I'm talking about? I thought it.
So,
I thought that was the previous summer. I thought it was 2017 actually was the pilot. So it didn't fall into the one-time pilot that's been designated here. I'm not sure what that one-time pilot that's being described here was.
If I could first respond to the bathroom cleanups.
Yes.
Was for the portable. Somebody just whispered that in my ear.
This is for the portable
This is for
ones.
the portable.
And so elsewhere in the budget, I assume we have the ongoing maintenance costs for the permanent.
I'd have to follow up with Public Works on that.
Okay, hopefully we do.
We will, yes.
We'll need to. Okay.
And then on the security services at the arts, this $187,000 reduction was related to, just my understanding of this item was it was related to police expenditures that were incurred in fiscal year 2019. There wasn't a budget line item for that. They just managed their budget and absorbed those costs in fiscal year 19. And so when we look at the fiscal year 20 budget where they're still not budgeted, that's why it shows up as this negative 187. I do believe public health also has money in your budget for security at Arch.
But can
that's
you
not
help me
related
understand
to
what
the
that police presence looked? I mean, there weren't, in the summer of 2017, there were 2 officers around the clock outside the Arch. That hasn't happened, as far as I understand, that hasn't happened since that period of time. We had considerable discussions before the budgeting process about whether we could have a line item in there to affect just that level of staffing. And I think the compromise we came up with was having some more general language about security services. But I'm not sure I can explain how that $187,000 was spent in terms of policing at the Arch over this last year. I just may be unaware of what some of those initiatives look like, but it was not an ongoing presence outside.
Ray Ariano, Assistant City Manager. So in this regard, I checked back with Chief Manley. There was a pilot, and I think it was maybe a couple years ago, where we tried to put an emphasis on presence in the vicinity of the Arch, and it's typically because of increased disorder, if you will, back in that particular time. This particular line item that's being described here, there was a budgeted amount for APD to provide some initial security presence, had a project to reconstruct a sidewalk in that vicinity that was contemplated for current year, but that never happened. And so, in previous years. And so what happened was this is backing out that dollar amount.
Okay, so let me just voice my general level of concern over multiple elements of that. I would say the pilot was responding to very similar conditions as we currently have outside the Arch, which is, we had a consultant come in from the National Alliance to End Homelessness who suggested that, part of the challenges in that area is that there is a drug marketplace taking place on the sidewalk. People are coming down to prey on individuals seeking services at the Arch and at Caritas and at other places, and that having an ongoing police presence out there, in addition to the other kinds of things that were launched during that summer, more caseworker presence and other resources. I know the mayor participated in those conversations as well. I mean, that was extremely successful to have that on-site security presence. And so, again, I hate to repeat myself, but last year, in response to the success of that, I tried to effect some security dollars in this area so that we could have a similar ongoing kind of presence, even though that was not, and this was the solution that was suggested to me so that we weren't overstepping our boundaries into the manager's territory or the chief of police's territory and requiring there to be an allocation of police resources in a particular area of town. I am concerned that those dollars didn't get spent in that way. We certainly have a need for ongoing security in that area for the same reasons we've had that ongoing need for multiple years now, and I think it should be an extremely high priority to make sure that individuals who live, work, seek services at our facilities in that area feel safe, which they currently don't. And I think the street reconstruction might have been related to the Red River project, possibly, which we've already had an opportunity in recent weeks to talk about level of frustration in the community and others, and I'll count myself among them, for the long time that's taking. So I I guess I'm going to need a better explanation of why those dollars didn't get spent and what we can do to make sure that we're not in that situation again, and what our plan is in that area. I'll leave it there for now. Thank you very much.
Yeah. Hey, colleagues, it's 10 after 12. Are we going to take a lunch break before we hear the last report on the convention center? Can we let the staff go till after lunch? Okay, so we'll take a lunch break before we do the convention center stuff. The staff can stand down and we'll start that right when we come back from lunch. Let's keep going here until we break for lunch. And
Okay, a couple of questions. So to follow up on a question of Councilmember Tovo's, one piece of information that would be helpful is the dollar amount for APD on homeless enforcement. We don't really have that in front of us. And I'm talking specifically, not in general, but I'm talking specifically about the kinds of questions that Councilmember Tovo asked. If we're talking about increased police presence and security, then we need to understand the cost of that, and we also need to make sure. I would support some dedicated. I would like to understand if we can dedicate some resources in that area. We've certainly done targeted police patrols in other parts of town, but they're episodic and from time to time. And the kind of concern that Councilmember Tovo is raising, I share her concern, and I'd like to see, understand how we're addressing that and where the dollars are for it, to follow up on her question. So then a couple of questions. So then, so the public health, Austin Public Health dollars. So the line item for operations of the South Austin Housing Center, which line item is that in?
It's included with the emergency shelter.
Okay, so it would be in that 8.2. There'd be a subset of that for operations, right?
Yes, ma'am.
Okay, and does that account for security, those operations? So in the definition of operations, I know that we're still working on the service provider contract, so we don't have the exact amount for operations, but I just want to make sure our estimate for operations included security. So does it?
It does not include Austin Police Department security.
I'm not suggesting APD.
But
I don't know what the best way is.
But it does typically, when we look at shelter operations, it does include a line item for them to hire security, yes.
For around, okay, all right.
Yes.
So, and then does it also include the dollars for, I'm not sure what the right term is, but for housing? Because it's a housing focused center, and the services include the case management type of services, plus the additional dollars to help people get into housing. So I don't know if that's called rapid rehousing. You know, for some people it might be 3 months rent, it might be 6 month rent, whatever it is. Are those dollars included?
No. This only includes the shelter operations.
Okay,
only.
so where are those dollars included in this budget?
Those dollars would could potentially come from either new projects funding or alternatives for temporary housing. Or those are the two lines that they could potentially come from.
Okay, so I'm confused because the resolution that the council passed said to put in the budget operations plus the dollars needed for getting folks into housing. So I know it's not going to be a whole lot the first year because it won't be in operations, October 1st. But I want to make sure that those dollars are in here and we don't have to find them else, and they're set aside for it so that we don't have to go find them. So where are they?
We can have a discussion offline
Okay,
about
that'd
how
be
to
fine.
include those in there, and we can get back with you.
Okay.
Thank you.
Okay. That was part of the resolution, so I'm expecting to see that. So, all right, you can get back with me on that. Then I wanted to switch to the question around cleanups, and related to that is storage and bathroom and all those kinds of things. Do we have a bucket? I think we said that we had a bucket of dollars here. I mean, we don't know exactly yet how to address those concerns around, I mean, we've said that we want to address housing first, obviously, but we've also acknowledged that there's some time period before everyone, where we get to a more ideal place with regard to housing. So is there a bucket? I think I understand that there's a bucket of funds that can be used for those kinds of things, for storage, for...
Yeah,
I'm trying to understand, where is that bucket of funds, and is that separate and apart from the cleanup bucket, or are we just looking at it all together?
Councilmember, on slide 29, the alternatives for temporary housing is
Okay.
1.5 million, and that would include some
So
of
that's
the-
what that is, okay.
There-
Okay.
There are many options for that source of funds,
Sure.
but that is the most flexible point at this, because we want to
Okay.
get more feedback and get some additional input from our homeless strategy officer and from you, council, on how best to allocate those funds.
Okay, so that's what we'd be looking at there, okay. And then so the cleanups are separate, and they're addressed, I think I'm understanding, the cleanups are addressed on that other page, which I'm not finding it now, but that's on page 32. I got it. All right, thank you.
Jimmy?
Well, I did a town hall in my district on Monday about the budget, but we ended up talking a lot about homelessness for all the reasons that we're talking about it now. We streamed it on Facebook Live if anyone cares to go watch it. But the question that I thought was really good from my constituents was, what are the metrics that we think will change as a result of this spending? And I understand that might be something our homeless strategy officer is going to get to, but it's kind of a half ROI question, half how will we know that when it worked, and when might we have those answers?
We can certainly compile the metrics related to this. A lot of what you're seeing is because, of course, the increase that we've seen in the number of people experiencing homelessness, just by that very nature, increasing the funding allocated to those services. But we certainly will take a look at the metrics that would be impacted by these and inform council as to whether or not we intend to see positive changes in those directions, or if it might be more status quo.
Yeah, and I'm not sure that there's a right or wrong answer, but I think people would feel good knowing that we were looking at that and that we were aiming to change those numbers in certain specific ways.
And just as a side note, council member, there is a budget line item in here on slide 29 on establishing that performance framework that is really important for staff to be able to say, how do we know if we're actually moving the needle on this? And so once we get our homeless strategy officer on board, working closely with Assistant City Manager Gonzalez and Shorter to be able to look at those goals and then making sure that each of our investments are making real progress on those goals.
Greg?
And I want to echo that I appreciate that many of these are earmarked for really good purposes, but I just want to lend my voice to the idea of providing some level of flexibility such that as we continue to scale and ramp up services, that if there is one investment we were thinking of and it is just not as good as something else that has come up, that we have that flexibility. And while each investment will have its own constituency, I think we need to just be as aligned as we can to make the highest impact investments this year, so that we're not just tracking how well we did against the metric, but that we're actually, to me, it's preventing folks from falling into homelessness and getting folks housed in services as quickly as possible in the next fiscal year. To me, those are the two things that I want to see happen.
If I could add to that real quick, I've been very reticent to do budget amendments, but for at this time, this is an area where I think I would be more open to, getting this stuff underway, getting the homeless strategy officer in, and if 3 months in we needed to reallocate because we had data or evidence, then I think we should be entertaining that. Much in the same way that we're looking at the entire budget that way under tax caps. I think we are just in a new reality where we're going to iterate, we're going to try, we're going to iterate, we're going to try, we're going to iterate, and I think we have to be all willing to do that.
Okay, Ann?
Just wanted to confirm. So the contract to establish the performance criteria, that's what you were referring to, the $250,000. So the thinking is that that will be some kind of contracting with some kind of expertise as necessary to establish the criteria. Okay, thank you.
All right, I think that's it. It's 12:20. Let's take a lunch break. What time do we want to come back? We have no executive